Hi there, my name is Asim Sheikh. I am an optometrist based in the United Kingdom in Scotland. The topic that we're going to speak about today is Innovate or Stagnate, embracing new technology in practice. So how we implement and the benefits and so on of technology in practice. For all the tourists and all the seaside lovers, if anybody would like to guess where this picture is from, this picture is actually a beach in Scotland, believe it or not, in the northwest of Scotland, a place called Sutherland. So white beach and clear blue seas is also available in Scotland for anybody that's wanting to visit. Just some disclosures that we have to give. One is obviously of Mid-Device Consulting and one is of BVI. So a brief introduction. We're going to talk about implementing new technology into our practice, explaining how you have to walk before you can run. There's no point trying to run too fast. And secondly, the benefits of this implementation and how we can proceed and make a better clinic for yourself. So, first of all, the first thing that's important to do is assess the current setup that you have. What is the aim? And what's the objective of what you're trying to achieve? Why are you wanting to implement new technology? And also assessing your current workflow. So you have to check your current workflow to see whether or not the instrument that you're wishing to purchase is going to be able to integrate into your clinic that you work in. One of the key things that is overlooked is discussing the needs and the requirements of this implementation of technology. The key question is, who do you want to discuss it with? Do you want to discuss it with yourself? I would say no. It's key and really important to discuss this with all staff members. At the end of the day, it's the staff members who know how the workflow is and possibly gaps in your workflow at the moment. The other key important point is what is suitable for the practice. Are you needing more equipment? Are you needing to change the workflow? Are you needing to change the type of equipment that you have? There's lots of different variables that are required to be looked at together. One of the things that I've experienced many times over the years is the ophthalmologist will, or whoever is coming to buy some new equipment at the Congress, they'll come and they'll see some new technology, they'll love it, which is very normal, and they'll buy it. The problem with that is, when I previously used to work as a clinical trainer, many times I used to go into clinics and a lot of the time the staff didn't even know that equipment had been ordered. They had no clue that the new equipment was coming. They didn't know that I was coming to teach on the new equipment. So it's important to involve the staff, all the clinical staff especially, on the new equipment that you plan to buy and why you want to buy it as well. The next thing is selecting the correct technology. There's so much available out there in terms of diagnostic things, surgical things. So having to choose the right one is really important. Here are some of them that are available. You obviously got OCT angiography, some biometry, and of course the BVI phaco system. Now, when you're buying the new equipment, it has to align with the aims of the practice. So if you're buying it, it has to be right for you. It has to be suitable for the staff. So the staff have to be able to use it. They have to be able to understand why you're buying it. And they have to see the benefit of why you're buying that piece of equipment also. Lastly, one of the most important things is making it user-friendly. If an instrument is user-friendly, there's more likelihood that the clinical staff will engage with that equipment more and enjoy using it. Then the key part, the implementation of the equipment. First of all, it's really important to utilize all the necessary and available training avenues. So you'll be offered training by the manufacturer, even by third parties. If you're able to, as much training as possible is key. So the more training you can get, the better. The super lady here on the right hand side of the slide, I like to call her the master user or the super user. I think super user suits the lady better here. And the reason for that is it's important to have at least one, preferably to people in the practice who are masters of that piece of equipment. If they are able to be masters of that equipment, then they can teach the rest, teach new starts, and progress that piece of equipment into the practice a lot better. The other key point is start small. Don't try and be too big too quick. Stage yourself through the process. If you try and be too quick too soon, you're invariably going to fail at some point or have some teething problems. However, starting small and progressing further on that way is a much better idea to go along. Now, one of the reasons why we buy technology, there has to be a benefit to the practice or the clinic. First of all, obviously, is the improved efficiency. The equipment has to better the practice. It has to make it more efficient. The more efficient the practice is, the better it will run. Secondly, the reduced costs. New equipment also helps with reducing costs of less labor costs, less technology costs. So it makes a big difference by reducing the cost of the practice. Thirdly, a really important topic is increasing the revenue. At the end of the day, the technology has to pay for itself. By increasing the revenue and by improving the workflow as a standard process to be able to make a better value for your practice. And thirdly, fourthly, a superior customer edge. If the patient knows that they're coming to a practice where the equipment is the best in the area or is the most technologically advanced, they'll be more likely to come. And with most people, probably men, the competitive edge, they want to be better than the practice next door. They want to be better than the practice along the road. So it'd be much better if a practice has the best technology, they will have that competitive edge as well. Now, the workflow optimization, a few points here. So there will be some adaptation required. So there will be some times where you'll have to move things, change things to make it better for the practice. That's very normal. It has to be streamlined to make it as time efficient as possible. There'll be a certain improvement to the waiting times. So people won't be waiting as long in practices if the equipment is used correctly, the people have been trained correctly, and it's been implemented in the correct procedures. Now, the patient journey is one of the most important parts of the whole process. You do all you're doing in your practice is mainly for the patients. You're wanting to make things better for them, you're wanting to make them enjoy it better. One of the main things that we can use now in terms of technology is involving the patient as much as possible. If the patient is involved and feels involved in it, they will be more inclined to return and they'll be more relaxed when you come. It's okay for us as clinicians who have been in the industry for many years to sit in a practice and know what's happening. For a patient to come first time to a clinic, it's like going to the dentist. People are nervous, they don't know what to expect. And it's the same when they come to an eye clinic, to an ophthalmology clinic. They're nervous, they're not sure what to expect. All these new machines are here. So it's important to involve them as much as possible. One of the ways of doing that is once all the procedures have been done and you've decided the next course of treatment, for example, if it's a cataract operation, for example, there are softwares available nowadays where you can send this to the patient to show them what's going to happen. I've got a brief video here to show you how that could go. So this is just Captivate Connect by Optimed, whereby these videos are sent to the patient. They can view it in their own home. They can view it in their own time, their own space, when they feel more comfortable. So this is all digitally made. The patients can see this in their own area, and it's a great innovation to have. I've used this myself in practice for many years, and the feedback we get from patients is next to the best that they've ever seen. This is obviously for glaucoma. We've got routine cataract stuff here as well. So all this is available to be sent through. Another one here, you can see on the screen here, all the different videos that are available. I can play this as well. So if we choose one of them here, this is where you would send it to the patient. So this is available to any practice. They're able to send the details to the patient. They can view it, like I said, in their own time and space. sent by email, by text message, anything of the sort is absolutely no problem at all. After that, one of the most important parts is feedback. You have to know what the patient's feeling. You have to know how they feel that the day went, how the appointment went, how this new technology is going. By doing so, you're improving the quality of the care, and also it builds a great relationship with the patient as well. They'll be honest with you. You can take that feedback and improve if you need to. If you need to improve, that's great. If it's positive feedback, that's even better. The other advantage of that is, in the feedback terms, is you get better patient outcomes. So the patient will give you the feedback, you improve from there, and eventually down the line, you will improve your outcomes by bettering your feedback, bettering your results from the feedback that you receive. After that, it's important that we continuously improve, and we do that via various means. One is professional development that you have to do year on year, but also by listening to patients, listening to your staff, listening to yourself. It's important that we have the whole system in place. One of the things is, firstly, plan it, what you're going to improve, do it. A lot of the time, the biggest failure is going from planning to doing. People plan it, but never really go on to the next stage. So make sure you get on and do it. Check once it's been done to see that it is improving it. So take feedback again from the staff or from the patients. Once that's done, act upon it and either improve it again or keep going with how you're doing it. Okay. So in conclusion, a few things. It's imperative to have a really clear plan. Work together. This is where I can't stress enough how important it is to work together. Don't be a lone ranger. Work together with your practice. Yeah, it's easy to be a lone ranger. So it's important to work with your practice, work with your staff and the patients as well to make the best possible results and outcomes for them. As I said from the beginning, it's really important to involve the patient in the whole journey. If you can involve them, they'll feel part of the team, they'll feel part of your clinic, and they'll return to you if they need to. Or, even better, the best advertising is by word of mouth. If you're able to give that patient the best treatment that they've had, they'll tell their friends, they'll tell their family, and you'll continue to grow and grow and grow. And finally, involve and evolve and make changes to continuously get better, continuously grow, and continuously improve yourself as you go along. So thank you very much. And if anyone has any questions, I'm more than happy to take some questions.